Greetings. My name is Winston Wellington Wright. I'm a first-year Master of Public Health student here at MSM. And it was mentioned that during the crack cocaine epidemic, the country criminalized the use and, of course, distribution of the drug, which, in my opinion, led to the desensitization of the epidemic itself throughout, the community and the culture. So I have two brief questions. Number one, at the federal and government level, is there any consideration for the social and cultural factors that may contribute to an epidemic such as the crack cocaine epidemic or the opioid epidemic? And for you, both being a former Surgeon General and current Surgeon General, what does the future look like in regards to how the country treats drug abuse, among its population?
Dr. Satcher?
Well, I'm hopeful about the future because I think the way we are dealing with the opioid epidemic is such an improvement over the way we dealt with the crack cocaine epidemic. Now, it pains me that the major victims of the crack cocaine were black males. And I want to make sure that we understand that the impact of that on the family and the community was tremendous. The HIV/AIDS epidemic and the spread of AIDS greatly impacted by the crack cocaine epidemic, greatly impacted by the fact that so many black men went to prison, and both in terms of the spread of HIV, but also in terms of what happened to black women back in the community. So I think that problem has continued to pain us and to really rob us of family and community.
So I'm going to reframe your question in the way it is usually asked to me. On radio shows, on TV shows, I've had this question many times. How come y'all care now that a bunch of white people are suffering? That's the way it's been framed to me, and here is my answer. What happened during the crack cocaine epidemic was because of stigma. It was because we were able to separate people into us and them, and call them bad people and us good people who made the right moral choices. The way you tear down stigma is to help folks realize there is no us and them. It's all us. We're all a part of this. So while we cannot and should not turn a blind eye to the damage that was done, the reality is where we are right now is exactly where we've been hoping to be. Folks are now starting to see the addiction as something that can affect anybody. Not black, not just black, but white, Hispanic, whatever. Not just poor, but rich. Not just urban, but rural. And so I think we have a real opportunity here to shine a light both on some of the things that have happened historically, but also on the disparities that exist currently because of what happened historically. Now, here's the challenge. We've got to make sure that the money, the policies, the programs that are put in place to treat addiction moving forward are applied in an equitable way. Because what we don't want is for now that it's affecting rural white counties and communities, that all the money and the funding goes there, and we continue to ignore the fact that there are black people, that there are brown people, that there are people of all different persuasions who are suffering from this epidemic and have long been suffering. So my challenge again to you all, and I leave you with a lot of challenges because I don't want you leaving here just thinking, man, Dr. Adams and Dr. Satcher that was really cool, but no impetus for action when you leave. The challenge is that when you're looking at this epidemic moving forward, always ask the question, are we making these programs available to everyone? And a great example of a place that we're not, and I know because I've been out in these communities, are diversion programs. So diversion programs, someone gets arrested for using drugs, and we give them a choice. We say you can either go to treatment or you can go to jail. Well, we know that diversion programs are expensive to run. We know that the places that have the capacity and the resources to put into place diversion programs tend to be more affluent communities. So we're seeing a disparity and an equity in the way in the availability of these programs, and we're continuing to send minorities to jail and more affluent people and non-minorities towards treatment. We've got to make sure that doesn't continue to happen, and that's where my focus is going to be moving forward, making sure we continue to tear down stigma by normalizing addiction as a chronic disease, but also making sure we're making treatment equally available to everyone.